Hi, Randy Alvarez here. You're watching The Wellness Hour, news that makes you healthier. We are here in Santa Monica, and we're talking about ozone therapy today with medical doctor, Dr. Howard Liebowitz. He knows we're coming. He buzzed. He got me in. Let's see if he's right here waiting for me. Dr. Liebowitz, all right.
Hey, Randy. How are you?
I'm ready to go. I'm
Good
excited
to see
about
you.
this. It's been a long time.
You're looking good.
Thank you.
We're going to make you look better.
Okay. Okay.
Why don't we sit in my office for a few minutes? I want to go over your medical history.
All right. All right.
Ask you a few questions.
Okay. Let's do it. So how long have you been at this location here in Santa Monica?
We just moved about a year ago.
All right.
Yeah, this is the new office.
And you're busy with ozone. I mean, it's hot right now.
Yeah, well, it's
Like millions of people are doing this across the country?
Yeah.
So this is where you meet with patients?
Yeah, this is
Little
my consult
consults.
room.
Very nice.
And then I have a treatment room for the ozone.
Now, you've been doing ozone for quite some time. I mean, you're not new to this.
Yeah, 2009. I'm doing this for, 15 years already.
And, you know, insurance doesn't cover this, right? But
Correct.
millions of people are doing this. In Europe, their insurance will cover these treatments.
Worldwide. It's
Is that
very
right?
big in Asia, too. Malaysia, China, Thailand, they're doing ozone. South America, Brazil, Cuba is very big. Spain is very big. Italy, huge in Italy.
And so, now, look, I have a basic understanding of this. I had it in 2017. So basically, this ozone is good for disinfecting things. I know in medicine, there are offices that shoot ozone to kill the bad bugs, mold, etc. In dental procedures, when they extract a tooth, when somebody has severe periodontal disease, they're shooting it into the area to disinfect. Is that what you're going to be doing today in a way? But it's going to be infusing it in my veins.
Right.
Is that right?
We'll be infusing it in the blood.
All right.
And you do get the disinfecting effect of it. But I think even more important, especially for a well person who has no specific medical problems, it's what we call an immune modulator.
Okay.
So if your immune system is overactive, if you have like an autoimmune disease, it has the ability to calm it down. If your immune system is weak and you're not able to fight something off, whether it's an infection or cancer, it actually jacks up your immune system to fight. And it has the ability to do both.
Like, does it increase white blood cells, or is it just by killing the bad bugs? What is it?
I think the exact mechanisms of how that works is not completely worked out. And that's why we call it a modulator, because it actually, for some reason, it seems to do both. It suppresses immunity when it needs to, and it boosts immunity when it needs to.
Have you seen reversals in poor health to good health, like every month here, every week here with this?
I would say on a regular basis. I would say on a monthly basis, I see incredible things happen with people all the time. From kids, I've treated 9-year-olds to 90-year-olds. And it's amazing how well it's tolerated with no side effects, no downside at all, no toxicity. We've even tried to elicit toxicity from it by using higher and higher and higher doses, and we still don't see any problems from it.
And we made a joke earlier about, the president one time, maybe he was being sarcastic, saying putting bleach. Can we just use these hand sanitizers or bleach and inject that in the body to kill the bad things? And you said ozone is very much like that.
Well,
is that
ozone,
right?
Yes. Those substances that I think he was talking about are oxidative treatments, oxidative compounds, and oxidative chemicals.
Okay.
And ozone fits in the oxidative family. So I think it is related. It's, something you can't do. Ozone is safe in the body, whereas those substances are way too harsh.
So I understand this correctly. Is it possible? Let's just suppose I've got a bad flu, or I've got something going on in my body, and my immune system is dealing with this infection that's going on in my body. Maybe I'm not aware of it, right? You give me the ozone treatment, it kind of kills some of the bad stuff, and now my immune system can now work on other things. Is that kind of how it works?
Well, it's even more specific.
Like it
than that.
lightens a load on my immune system?
It does that, and like I said, it modulates the immune system. So, for instance, in COVID, what we saw, which was incredible, was the ozone actually was killing the COVID virus, and at the same time, it was modulating the immune system, because one of the most serious consequences of COVID was what was called the cytokine storm. I don't know if you heard about this in the news, but they were talking about this. This got into the lay press as how the cytokine storm, which is an inflammatory reaction that got kicked off by the virus, and it produced tremendous amount of inflammation, specifically in the lungs. So they called it a respiratory virus because of how it affected the lungs. And most people died, actually, who did die from COVID, they died a respiratory death. And that's why they were intubated, they were in the intensive care units. It was found that ozone actually stops the cytokine storm. And when people were given ozone for COVID infections, they actually got better. And they got better quickly because it had this powerful anti-inflammatory effect with no side effects. At the same time, was killing the virus.
Okay, so you had people with fast recovery, rapid recovery
Very
with
fast
the ozone?
recovery, 1 to 2 days from serious COVID infections. I've treated here in the office many, many times. And my colleagues have too. So if you talk to other doctors doing ozone, they'll all give you the same
So does this fall
story.
into that biohacking, longevity medicine, anti-aging medicine? Is it? Would you say that?
Well, that's a different category of ozone, but ozone does have an effect also of boosting your stem cells. It's been shown, and we'll be doing that for you actually, because when we're going to go up to 10 bottles, it's been shown at 8 bottles, you get a release of stem cells out of your bone marrow, and then your stem cells are circulating in higher percentage in your blood, and they go all over the place and they heal tissue, as you probably know.
Now, you've been doing this for so many years. What's your expectation for me as far as how I will feel in the next few days after this?
Well, the thing is,
'cause I feel pretty good already.
Yeah, that's what I was just going to say. If you're feeling really good, you might not notice a lot, but a lot of people who do feel something from ozone, they feel more energetic, they feel more alert. Some people tell me they feel like their brain is working better. I've had people go straight from my office to the gym and work out, and they work out harder. It clears lactic acid out of your body. I had one guy who broke he went to Equinox here in Santa Monica, and he broke the gym's weightlifting record right after an ozone treatment. I've treated professional athletes with this. I think it might be a performance-enhancing substance.
So the challenge, though, is because insurance doesn't cover it, most doctors may know the benefits of it, but they're not set up as a cash pay system. Is that part of what's going on?
I think that's part of it.
Insurance doesn't cover it.
I think also a lot of doctors play by the general rules of what's common in the community. And ozone tends to be considered like a fringe treatment. It's not FDA approved. A lot of doctors don't like to get involved with things that are not FDA approved. It's very big in Europe and very popular in Europe. And lots of countries use it frequently in Europe.
But if it was covered by insurance, you think more and more doctors would do it?
Absolutely.
100%.
Absolutely. 100%. I feel like if they put ozone machines in emergency rooms, I think we would have saved so many people.
You know a thing or two about that. Now, you worked in the ER at Cedars, is that right?
Yeah, long time.
What was your role there?
I was a full-time ER doc.
Okay.
In the ER, yeah.
And what would so let's say, knowing what you know now, what could you have done, what type of conditions would this have been ideal for?
Well, in the ER, the big benefit would have been infections.
Okay.
Acute infections, because the long-term problems like cancer patients, autoimmune patients, those types of patients, people with long COVID, people with Lyme, those types of patients, they need ongoing ozone therapy. They don't need 15, 20, 30 treatments sometimes. But the patients who came in with an acute infection could get an ozone treatment in the emergency room and potentially be better in one day.
And you had to throw antibiotics that kill the good and the bad bacteria.
Correct.
What about this? Does the ozone today kill the good and the bad?
It doesn't kill good bacteria.
Okay.
It just kills bad bacteria, infectious bacteria, invasive bacteria, and then at the same time, as I mentioned, it upregulates the immune system to help fight the infection. So you ready for a treatment, Randy?
Okay, I'm ready to go. Is this going to hurt?
Well, we're going to start a little IV. It's going to feel like a little pinprick.
Okay.
It's not too bad.
All right.
And then we'll be off and rolling. The rest of it you won't feel.
Okay.
Yeah. Okay, so what we're doing today, Randy, you're getting a really great treatment.
Okay.
You're getting high-dose ozone. We call it the 10-pass, which is high-dose ozone. And at the same time, I'm going to run it through the ultraviolet blood irradiation box, which is going to activate your white blood cells and kind of boosts the ozone treatment and makes it like a hyper-ozone treatment.
Okay, so the ozone's going to go in, kill a lot of I'm calling them the bad bugs, but it's going to kill maybe some bad things that are in my system.
If you have some, yeah.
And then the blood is going through that machine, and then it's ultraviolet. It's going. How's that working over there?
So the blood's going to go through the ultraviolet box, which is right here. on its way up to the bottle,
Okay.
and then it's going to pass through the box again when it comes back to you.
So it's going to cleanse my blood.
So it's going to cleanse the blood, and it's going to activate your immune system. So your immune system's going to get revved up, and then this whole treatment is going to activate your detoxification.
So it's going back into my arm.
Yeah, all this blood's going back to you.
So it's going out, getting cleansed, and coming back.
Correct.
Okay. And will I feel anything from this today? Like a little bit? Because I remember last time I felt like this euphoric feeling.
I think you might feel that. And some people just feel a lot of energy. They feel like their brain is clear. Some people tell me they feel like their vision is better.
Okay.
You know, ozone saturates your body with oxygen also. So all of the systems in your body, everything tends to work better. Your kidneys will work better. Your heart will work better. Your liver will work better. Your lungs will work better. Every system in your body. Your brain's going to be very happy with lots of oxygen. Now I'm starting to give it back.
So now you've been in and around ozone now for how many years?
I've been doing this since 2009, 15 years.
So for people that don't know, you started out, give a little bit of your bio. I mean, you were a mainstream medical doctor at Cedars-Sinai. You worked in the ER department. What'd you do?
Yeah, I was a full-time ER doc for most of my career. And then in 2005, my ex-wife and I decided to open an integrated clinic together. And I didn't really learn about ozone until after I left that clinic. I met somebody who introduced me to it at a conference, and I was just immediately drawn to it because of all the benefits that I was told that it had. And some of them I didn't even believe worked until I started doing the treatments myself, and I started seeing incredible results in my patients. Things I'd never seen before.
I hate to interrupt, but you say that you've had people with, like, for example, Lyme disease, and that goes into remission, or at least the symptoms associated with that. And lupus. You've seen people go into remission with lupus.
Rheumatoid arthritis.
Arthritis.
Kidney failure. Cancers. The big thing that I was shocked with, and so were many of my colleagues, was how well it treated COVID.
Okay.
And it was amazing. I think if we had been able to give this more mainstream during the pandemic, we could have had a big impact on helping a lot of people recover from COVID. There were studies done in Europe. There was a big study done in Italy with 20 hospitals participating. That's a big study, 20 hospitals. And they were giving their patients who had COVID ozone treatments. Not even this is a very high dose ozone treatment. They weren't giving it this high. They were giving probably the equivalent of 1 or 2 bottles every 8 hours around the clock while they were in the hospital.
Okay.
And the people they gave the ozone to, generally, if they were on the floor, they weren't in the ICU, all of those people went home in 3 days. Nobody went to the ICU. The patients who came in sick already, and they were in the ICU, they were giving them the same treatment around the clock, every 8 hours. 92% of those patients in the ICU got better and went home. 92%. Only 8% died, compared to New York, where 80% died.
Okay.
And they still wouldn't allow us to do this here. It's incredibly anti-inflammatory. Like we were talking, how it kills bugs, it kills organisms, it kills viruses. Well, it kills the COVID virus. It's been found to kill the COVID virus. And it decreases inflammation. And one of the big problems...
But because it's natural, right? And the insurance companies don't cover it, the FDA doesn't approve it for certain things like we're doing today. But there's millions of people that are taking advantage of doing it across the country. Well,
the FDA actually came out with a blanket statement about ozone probably 30 years ago. And they said it's a toxic substance and it has no benefit in medicine. And they've never looked at it again. They've never revised their statement. They just leave that statement out there. So in America, most doctors don't want to get involved in it because the FDA says that about it. And they don't want to get out of, touch with what's considered.
But if they knew what you knew and saw what you've seen here in this office, as far as people feeling better, turning their disease states around, do you think they would more and more would do it?
I don't know. We talked actually in the last video we did in 2017 about that lady I had with metastatic breast cancer, how I put her in remission, where everybody thought she'd be dead in 3 months. And she's in full remission with no detectable cancer after 32 ozone treatments. Don't you think her oncologist might have been interested in what I did and maybe offer it to his other patients? No. You know what he said?
But what?
He said that was spontaneous remission. He didn't give the ozone any credit at all.
Yeah.
Where does that come from?
So is it one of those challenging things, like, for example, I know you're big on nutrition, that you take, let's say you get rid of gluten, dairy, soy, corn, get them exercising, getting them sleeping again, de-stressing them, and then some of their autoimmune goes away. They don't give the nutrition credit either. Is that correct?
I think so, yeah. I think a lot of that will help for sure. I think if you do all of that and you combine that with ozone, I think you'll get phenomenal results.
But in the same way nutrition doesn't get the credit sometimes,
yeah,
ozone doesn't get the credit.
Except
because it's an alternative therapy?
I think ozone is more scientific than that. Okay. Because there are other countries that do this and it's acceptable, and there are tremendous results, like the results we got out of the 20 hospital study in Italy. And in our country, they just didn't accept it. They said this is an unacceptable study. Why? I don't understand why they wouldn't accept data from another country, especially when it's saving lives, especially when you have people dropping dead left and right with no option. This can't hurt anybody. This has no side effects. There's no downside to giving someone an ozone treatment, especially if they have a fatal illness like COVID.
Do you give your family members
ozone?
All the time.
You do? All the time.
All the time.
All the time.
So you're a former triathlete. I mean, you've been involved in health your whole life, right?
Yeah, pretty much. I used to work at the old Pritikin Center. You remember Pritikin?
Oh, is that right? The diet center.
From the 80s?
Yeah.
Yeah. I go way back.
So this is what you've been doing all along. You're right here in Santa Monica. And people need to know, look, I'm not endorsing this treatment, but in a way I am. I mean, I know him by reputation. I think I met you about 25 years ago, and you have a good reputation. You're known as a mainstream physician that does nutritional therapies, hormone optimization, and these type of treatments. Is this a disinfectant? How is ozone being used to disinfect? Like, I hear something about like instruments, like medical instruments, things like that.
You can put medical instruments, surgical instruments in a sterile bag and pump ozone gas into that bag, and those instruments will be sterile. I've heard that they will pump ozone gas into an operating room and sterilize the whole operating room before they'll do surgery, because it is so good at killing off organisms.
And this infrared stuff that you're infrareding, I'm calling it, you correct me here, but you're infrareding my blood, it's being pumped back into my body.
Correct.
Like, in a way, kind of sterilized. Do they use infrared also in medical facilities to clean instruments, things like that, or no?
Not so much. No, I think there are some light. I'm not sure exactly which lights might be used for sterilization, but I think there are some lights. I think they're more blue lights than the red lights. These are more of the red wavelength lights, the ultraviolet.
So when you say it's
These
activating my immune system, is it the white blood cells that are now coming alive, or what?
You're getting activation of T cells for the most part. And then
the T cells are the cells that do what?
They're the immune activated cells. The B cells mostly make antibodies.
Okay.
And the T cells are like the killer cells that go out and kill organisms. So those are the ones that are getting jacked up. They're going to be increased, and they survey your blood. They're circulating all the time. And if they have an interaction with an organism that's not supposed to be there, they attack it and kill it. So the ozone increases that activity.
So is this the only way you get ozone, is through this type of setup?
This is a very high potency way to get ozone. There's all sorts of new ways that are on the market now. There's one called ozone dialysis. People call it EBOO, E-B-O-O. It stands for extracorporeal blood ozone oxygenation. It's actually developed in Malaysia, if you think of all places.
Okay.
And there's an IV started in both arms. And the blood comes out of one arm, and it goes through a dialysis chamber. And in the dialysis chamber, a tube from the machine is connected and pumps ozone. So as the blood is trickling through the dialysis chamber, it's picking up ozone. And then it goes back and goes into the other arm. I've looked into doing that, and people say it's a higher dose even than this.
Okay.
I've gone much higher than 10 bottles. I've gone to 30 bottles treatments on people with no problems. And the doctor in Austria who developed this whole protocol has gone to 40 bottles. The EBU is probably equal to maybe 20, 25 bottles of ozone at a time. But, you know, it's fraught with a little more complexity because you have 2 IVs and, you know, they sometimes get blocked and you have to flush them and, you know, it's a much more laborious treatment.
So this is, I mean, even doing what you're doing right now, I guess is time consuming. I mean, the doctor has to sit with the person. What are you doing? I mean, you're changing bags?
No.
Is that what you have to do? Like, why do you have to sit here is my question.
I'm changing pressures on the machine.
Okay.
I have to control the machine because what this machine does, this is a hyperbaric medical ozonator. It's one of the best in the world, I think. And one of the things that it does is it changes pressure in the line. So when your blood's going up into the bottle, it creates a negative pressure in the bottle, a vacuum. And then when I want to give that blood back to you, I pump the ozone through this clear tube into the bottle, and that increases the pressure in the bottle. It's called hyperbaric ozone, and that high pressure ozone mixes with your blood. At the same time, it pushes the blood back down the tubing to you.
Okay.
So there are not a lot of machines on the market that can do this hyperbaric type treatment.
Now, knowing I was going to come here today, and I interviewed you about this in 2017. What did you want people to know, maybe that could be said better today? Or maybe how has your understanding changed or shifted from those days? Like, what do you know now you didn't know then?
I think probably the biggest thing I've observed in doing these treatments all these years is that, generally speaking, the more ozone you get, the better.
Okay.
Because people ask me that question. A lot of times they'll come in with an illness, whether it's a cancer diagnosis or long COVID or chronic inflammatory conditions, and they'll ask me, one of the first things they'll ask me is, how many treatments should I get? And it's very hard to quantitate. I usually take it treatment by treatment because everybody responds to these treatments differently. Even though we're giving people the same dose, the immune system is going to react according to what the basic physiology of the person it's going to be.
Okay.
So say you're very toxic or say you're very frail, your immune system might not have the robust reaction as a healthy person. So some people might need more treatments than other people, and some illnesses need more treatment than other illnesses.
So in the case of your lupus patient that you got remission, you said about 3 months.
Yeah.
After 3 months.
Intensive treatments, 1 or 2 a week.
Yeah, and that's not, I mean, an hour.
And my cancer patients generally will get 2 a week for also 3 months or so. And some cancers don't respond. I mean, it's not 100%. I can't say I can cure every single cancer with this. But I try because I never know. I really can't anticipate what's going to happen.
I mean, everything you do as an integrative, what do you call yourself? Integrative physician, anti-aging medicine doc?
I'd say alternative medicine.
Alternative medicine, okay.
Yeah.
But everything you're trying to do is to promote the body or the immune system to do what it does best, right? Heal itself or keep itself
I would say so.
Well and healthy.
I would say so,
and this
yeah.
is one of those like cheats. It's like one of those things where you can like detox yourself. I guess you could go through like a infrared sauna, right? That's one way to detox. But this is a deeper way to detox. Is that right?
Yeah. Well, the thing about ozone is that, first of all, it's not one size fits all, number one. And number two, it's not even like a specific treatment for a specific illness. So it can treat so many different things. Even healthy people can benefit from it. And that's why it's such a great treatment because, you know, a lot of medicine that we do, traditional medicine, you'll get a treatment that's designed for a specific diagnosis. This is different because this has a general effect on the body to upregulate the body's natural fighting ability and health and strength ability to fight off whatever it's dealing with.
If a medical oncologist is watching this, what do you want them to know about this?
I would say that this is a fabulous treatment to integrate with their traditional treatments because one of the things that happens with a lot of cancer treatment, whether it's radiation or it's chemotherapy, is it debilitates the body and it weakens the body as well as trying to kill the cancer cells. And the ozone can actually help support the body and allow the person to even tolerate their traditional treatment. And then in some cases where a traditional treatment may not even be at all effective, like I've had patients with 10, 15% chance of success with chemo, sometimes this actually works when the chemo won't. So there's such a wide spectrum of benefits.
Okay, so you implied that you've had people that were given a 15% chance of living, and now they did this in combo with their chemo, maybe.
Actually didn't do chemo.
Didn't do chemo, just did this.
Just did this.
And they got better in how
3 months, full remission. I've seen,
really?
We talked about it last time, a woman with metastatic stage 4 breast cancer. I couldn't believe it myself.
So the blood work will show and match up what you're saying.
It was more than the blood work. She had a PET scan, head-to-toe CAT scan. And her first CAT scan, she had spots in the liver, spots in the pelvis, spots in the spine. And we did the follow-up after 3 months of ozone, all gone. The radiologist called up the oncologist and said, this isn't the same patient. There's no cancer in this patient. He couldn't believe it. He said it's the wrong patient.
Did you ever get in the loop in that conversation with these doctors?
Nope, we never.
Can you get in trouble for some of the things that you're saying here in this interview?
Well,
and you find yourself being careful with your answers because this will be online.
Basically, what I'm talking about is my own personal experience.
Anecdotal.
These are things I see.
Anecdotal stories.
Treating my patients. I'm not making things up. I'm not pulling things out of crazy literature. I'm seeing these in my office every day. I see this happen. I'm basically relating to you what I see.
Yeah.
So if someone wants to suppress that, it's like a First Amendment issue. They're just preventing me from talking about my observation.
You know, prior to coming in here, I was talking to this oral surgeon, and one of the things he uses ozone to disinfect the pockets rather than giving them antibiotics or rinses that are very harmful to the microbiome in the mouth, right? And I said, well, if it works as well as you say it works, why isn't everybody doing it? And he just said, it's just slow to change. People don't believe it.
People don't believe it.
We can swab the mouth and prove it. We could show a before and after with the bad bugs in the mouth, and then the after with a healthy mouth.
Well, the problem...
So I guess it's challenging no matter what.
I think the problem with ozone data is that it's not organized. And, you know, when you do a pharmaceutical study, it's very organized. You know, you have a controlled environment, you have controlled patients, or you have controlled lab animals, or whatever you're doing it with, and it's very controlled, it's very precise, and it's very measurable. When you're doing ozone treatments, it's anecdotal, every patient's different, every practitioner is different, but on the other side of the coin, this is all over the world. There are millions and millions of people who've gotten ozone treatments. Probably more people have gotten ozone treatments than any other medical treatment in the world, in more countries in the world. And it's been around for over 100 years. Ozone's not new, which is a big misconception.
Now you explained to me this about 18 years ago, 20 years ago, when you, at your integrative center, that people come to you, and I'm paraphrasing slightly, but people come to you in different levels of damage to their metabolism or damage to what they've done, whether it's heavy metals or whether it's they're not sleeping, they have anxiety, they're drinking too much alcohol, or they're insomniacs. So is that what you mean by where it's different for everybody as far as the ozone treatment?
Exactly. A lot of the effect of how this works depends on what we're starting with. So,
but it's a combination of therapy still. Like if you didn't know me and I pretty clean, when a patient comes in, are you also advising them on nutrition and supplementation?
Sometimes. Not all the time, because the patient doesn't come to me as like a general patient who wants me to take over their overall health care. A lot of the patients that come for ozone, I feel in a lot of regard, I'm like a surgeon. They come to me just to take out the appendix.
Okay.
And then once I've taken out the appendix, they're all gone and they're on their wherever they're going for the rest of their care. So a lot of patients will come in, they'll do their ozones, and then they go back and they get other treatments from other people. Sometimes, as we're sitting here chatting like I am with you, something will come up. Like we'll be talking about their health, and something will come up, and I'll say, gee, that sounds like it could be a thyroid issue. That sounds like it could be your hormones, or that sounds like it could be toxicity. That sounds like it could be heavy metals. Something will come up like that, and then they'll get curious, and then we will investigate and look at it. But most of the time, the patients don't just come in, and sometimes they do, but most of the time they don't just come in and say, take over my healthcare and help figure out what's wrong with me. Most of the time they just come and say, I want ozone.
Is it a more educated patient? Like before they show up, have they done a lot of research? Have you found? Or are they more desperate? Like they're worried of a cancer diagnosis, whatever?
It's kind of all over the map. I have some patients who are real health fanatics, and they've been all over the internet, and they found ozone, and they just want it because they heard about it, and they think it's going to help them. And then I have other patients, like you're saying, who dig deep, and they do tons of research, and they read studies, and then they come in, and then I have patients who get referred by other doctors sometimes. Mostly they're like alternative doctors, I would say. It would be a lot of naturopaths, chiropractors, people like that, who have told their patient, you should get ozone.
And you have
try to keep your arms straight.
And you have naturopaths that refer you patients. Is that right? I mean, your daughter's a naturopath.
Yeah, she works in the office with me. Yeah. And a lot of those people, because this is a natural form of healing. This isn't something that you're putting chemically in the body. This is basically a derivative of oxygen. And once it hits your blood and it goes in your body, it just turns into oxygen. There's no side effects. There's no toxicity. There's nothing your body has to excrete.
So I'm being cleansed right now, right?
I wouldn't say cleansed. That's a little bit of a misconception.
Okay.
But your blood is being treated to be like more effective at what it's supposed to do.
Okay.
All the cells, whether it's to carry oxygen, whether it's to fight infection, whether it's to fight cancer, whatever those cells are supposed to do, they're going to do it better.
So I should probably come in, ideally every 3 months, get this done for longevity?
I think for a well person, healthy person who wants to maintain optimal health and even slow down the aging process, I think 3-4 times a year getting a treatment like this is an excellent addition to health maintenance.
What's your oldest patient?
94, I think, 94.
Is that right?
I had this little old lady. She was sitting right here, all slumped over in her wheelchair. Tiny little thing. I couldn't believe it. She was getting ready to go on dialysis. Her kidneys were failing. I didn't know if I could even help her. And we started off on these treatments, 10 past treatments, no problem. No problem. She did about 10 or 12. She was coming once a week. She got taken off the dialysis list. Her kidneys improved. At 94 years old, her kidneys improved with this. I couldn't believe it. That was, to me, shocking. I didn't anticipate that.
Now, a lot of these patients, is it true, they get well, and then you don't see them again? So you don't get all the follow-up stories?
That's true. That happens a lot.
Now, are there people that have been through the treatment, you don't hear from them a year, and then they come back and get some touch-ups?
Sometimes. It's all over the map. And, unfortunately, because insurance doesn't pay for it, it's cash out of pocket. And I think sometimes the finances actually dictates whether they can continue having treatment.
It's less than Botox. I know your pricing.
Yeah.
Less than Restylane or some of these anti-aging things people are doing.
Yeah, it is. But still, for some people, it's a stretch.
Less than these GLP-1 like Mounjaro or Ozempic.
Could be half of that. Yeah. And those people do it every month, right?
What are the frequently asked questions that you want to address today?
I'd say a lot of people commonly ask me how many treatments they should get, how frequently, and how many. And that's sometimes a very difficult question to answer because, like I've said, there's no studies. So we can't take a patient who, say, has, Lyme disease or lupus or rheumatoid arthritis, and I say, well, we treat those patients and they have X number of treatments, they get better. Everybody gets better at their own pace and their own course. So I tell people, I say, let's just start off. We have to start off somewhere, and often I recommend starting off once a week and going through a treatment of anywhere from 7 to 10 treatments and seeing how they feel. If they get better, and they get better dramatically, and sometimes they do, then we can back off.
Are they able to wean off their medications? Do you have people that are on different medications that have been able to wean off or go completely off their medications?
I have people who actually come in to do Ozone because they didn't tolerate their medications. They're having side effects from their medications that they don't like, and they're looking for an alternative way to treat their illness without having to take that medication.
Why is this good for the heart?
Well, because it saturates you with oxygen. So the heart muscle is very oxygen hungry organ because it's always moving. It never stops. So if you can give the heart a lot of oxygen, it's very happy.
Okay, okay. And what are the...
Same with the brain. The brain is a hypermetabolic organ too. So you saturate the brain with oxygen, and you know, I've had...
They talk in terms of this blood-brain barrier. Does it somehow seep into the brain to kill some of the bad bugs there?
This is in your blood, and yeah, it's oxygen. All your cells have to have oxygen to function and live. And what we're doing with this is we're actually saturating them with high doses of oxygen. And it's directly into the bloodstream. You don't even have to breathe it.
So they feel better. How often do they get blood work? And and what kind of changes do you see in blood work?
I don't really follow the blood work. It's not like a parameter that I could measure. I base my results and success typically on how people feel, and sometimes things like that lady who had the PET scan for cancer. You know, sometimes we do have a measurable parameter we can look at.
But you do blood work. I mean, you test people for blood work all the time.
Yeah.
Why not do it in this case? Like look at hormone levels, or look at... Can you even measure immune response, really?
I've never done that. I've actually never looked at that. And then, you know, it gets expensive too, and a lot of people don't want to pay the extra money for it.
So it's how they feel.
Generally,
they
how they
know
feel.
when they feel better.
Generally, how they feel and when they feel better, yeah.
So a person that had lupus no longer has lupus. What do they say when it's all done? 3 months later, like what do they tell you?
Well, they're just like super happy. They're feeling better. Every treatment, they're feeling better and better and better and better. Less and less.
Like the rashes on their face go away, things like that?
Joint pains go away. I mean, I've seen kidney function improve because lupus affects kidneys, affects lungs, affects almost every organ system. And sometimes in those situations, we can do blood tests and document, like for instance, if the lupus is affecting the kidneys. Like this elderly lady I treated who was getting ready to go on dialysis. That was measurable because we were following her kidney test. She was getting a kidney test every week, and her kidney tests got better and better and better. They got so much better that she didn't need dialysis. Her kidneys were functioning normally after 10 of these treatments. I couldn't believe it. So sometimes we can measure things like that.
Now, what about like elite athletes? And they're doing this?
I think some elite athletes are doing this. I think they don't talk about it. I think there are some professional athletes who even have equipment at home and have practitioners coming to their house and giving them treatments on a regular basis, and they don't talk about it. But we have some anecdotal evidence that this is probably happening because I think ozone could be in the realm of a performance-enhancing substance.
Really? Okay.
Yeah, I think if you took it before a competition, I think you would compete far better.
Do you think combined with women's bioidentical hormone therapy and ozone, it can help? And if so, how?
Well, I don't know if it directly impacts menopause. Is that what you're asking?
Yes, all of the above.
I wouldn't say it has a direct impact on menopause per se, but if a woman is dealing with sometimes inflammation, which sometimes happens in menopause, sometimes women get arthritis as a result of losing their female hormones. I think the addition of ozone to the female hormones could help tremendously.
So for autoimmune diseases, across the board, this is great.
Across the board. Across the board, it's excellent.
Now, maybe you don't know the mechanism, you do know the mechanism. What's your take on why it works so well with arthritis?
Well, it has a very, very powerful anti-inflammatory effect on the body. So in things like autoimmune, like I was mentioning before, ozone is an automodulator. So if your immune system is overactive, which is what happens in autoimmune disease, your immune system is attacking your body.
Okay.
Ozone has the ability to calm that down. So you don't have the attack from your immune system on your body. And if you cut that out, then the inflammation goes away and you feel better.
Okay. Is that cytokine storm?
The cytokine
or
storm
different?
is more of a reaction to like a specific infection. So that was very common in the pandemic. A lot of people who ended up in the intensive care unit ended up with inflammation in their lungs. And it was a cytokine storm that attacked the lungs. And ozone was found actually to stop that, actually stop the cytokine storm. And that's how a lot of people who had COVID got better. Because COVID was primarily a respiratory virus. It had a huge impact, a negative impact on the lungs.
Okay.
And when we gave those people ozone, it actually reversed that.
Do you think ozone will ever become, like 20 years from now, 30 years from now? What's the future of ozone therapy? In your estimation?
I wish it would become more mainstream because it's such a good treatment. It has so many benefits and it has like no negatives. And there's almost nothing in medicine like that. Everything in medicine is risk versus benefit. When you're looking at a treatment, when you're looking at a medicine, when you're looking at a surgery,
okay,
when you're looking at doing anything in medicine, the way to approach it is look at the risk, look at the benefit, and weigh them. Is it worth it? And when you look at ozone, the benefits are tremendous and the risks are negligible.
What about Alzheimer's? Things like that. I know this is a tough topic, but
Yeah.
look, they're saying this type 3 diabetes for Alzheimer's. I'm reading, my mother had Alzheimer's. I've tried to do as much research as I can about Alzheimer's, but these amyloid plaques, they're saying that through nutrition, through an anti-inflammatory diet, they believe that you can push it off and maybe even prevent it. Because that helps your immune system by eating correctly and taking the right supplements and getting sleep and all of those things. What do you think about the impact on Alzheimer's? In your opinion?
I don't have any direct...
What's your take? I mean,
well, I would
without
say,
being politically correct, I guess. What is your take on it?
I don't have any direct data that connects ozone with treating Alzheimer's. I couldn't make that claim. But in general, I would say any patient for like any illness, whatever they're dealing with, I think ozone would basically help make their body healthier and help support their health in general without specifically addressing an illness.
Who does this work best for, and who would you like to see more of? Maybe they see this video online, they get on a flight, beautiful Santa Monica. What would you like, what conditions would you like to see more of? Or what type of patient? More of the healthy people like me, or more of the people that are like long COVID patients? I have a good friend that they're dealing with long COVID.
All of that. I think all of that. To me, it was heartbreaking during the pandemic that we weren't able to treat more COVID patients because it was found to be so effective against COVID. And we were basically stymied from offering it. And there was a suppression of ozone. They put ozone in the same category as all these other like fringy type of treatments. They considered it unproven. And I think COVID's still there. Other respiratory viruses are still there. Flu is still there. Flu kills people. Viral illnesses, I think, will respond to this very, very well. And I think if people knew that this was available, and they do know it's available, like in Europe, I think a lot of doctors give people ozone in their office. People come in with a cough and a flu and a cold and sore throat. I think they pop them on the ozone machine readily. And I think if we did more of that here in this country, I think people would benefit tremendously from it.
And, but I guess it involves can an RN do what you're doing right here?
Yeah.
So an RN can do it?
Nurse practitioner can do it under the license of a medical doctor. Yeah. But there has to be a medical doctor in the facility who supervises, so to speak. I do my own treatments because I am more hands-on than a lot of other practices, but there are a lot of practices that the doctor doesn't do the treatment, and they do have a RN or someone else do it.
Okay, and so everyone over 70, 75, they're at risk, right? Their immune system as you get older, maybe gets a little weaker over time. So do you believe that everybody over 70 should look into this and give it a try?
I think it's a great idea to do some type of immune surveillance like that, is get a treatment periodically to keep your immune system robust and help fend things off. Or if you start to feel the symptoms of something in the very early phases, the earlier we treat, especially a viral illness, the earlier I could treat the person, the better response they're going to have to not getting sick.
Like a stage 1 cancer would be ideally where you want to catch them.
Oh, for sure. The more severe the illness, the more treatments we have to do. The less severe, the more mild, the easier it is to treat and get rid of.
Now, I'm interrupting you a little bit because I felt like we only have 60 minutes. So I'm trying to get all these questions in. But what is a question you want me to ask you? Or that you knew? Again, you knew I was coming here. Like what is your main message about ozone?
I just
other
think
than it works. You believe it works?
I think it just needs to be more in the public's eye. And for people to know that it's a very safe, beneficial treatment that's available for them to take advantage of, and not to put it in the category of fringy treatments, because it's not.
Okay. Because even hyperbaric, I have plastic surgeon buddies that are in business, and afterwards, now they're using hyperbaric. They're using other things to help with the healing process. How is this for that crowd, for people that maybe had a knee replacement, hip replacement, whatever?
It can help all that. It can help all that because it's going to help the body heal, and it's going to decrease inflammation. So anytime you have a surgical procedure, you're going to have tremendous amount of inflammation in the healing site, and ozone can help speed that along. It's incredible for burns. Ozone is an incredible healing modality for burns, because one of the problems with burns is the risk of infection. Once the skin barrier is broken, the risk of infection. So using bandages that are soaked in ozone is so antiseptic.
Is that right? Are they doing that now?
I don't know if they're doing that, but it's been used in the past and has been shown to be highly effective in preventing infection in burn patients. And they should have this in every burn center, I think. I think it would be incredible.
When you talk to your medical doctor buddies, because you came from the ER at Cedars, do you ever tell them, hey, you got to look into this ozone?
Yeah, they look at me cross-eyed. They have no clue what I'm talking about. They think I've gone crazy.
Is that right?
Yeah, because they just don't know. They don't know anything about it, and they've never taken the time to read about it, or they're not interested in it. It's not mainstream medicine.
Look, 25 years ago, I have the news show, The Wellness Hour, airs all over the country. 25 years ago, I interviewed an endocrinologist from the Mayo Clinic. It was a female physician. And I, from firsthand experience, knew a lot of people that type 2 diabetes was reversed with diet and exercise and nutrition, right? And at that time, I asked her, can you reverse type 2 diabetes? Even if she goes, you cannot. And I said, you can't do this. No. And so then so she leaves my studio, and I talk to my doctors, and I know you're one of them, that you've seen reversals in type 2 diabetes. And I said, well, why would she say that? Is it because she's ignorant? Is it because she's not looking at the literature? He says, because if you, as a doctor, if you don't see it in your practice, sometimes you don't believe it exists. Do you think there's truth to that? Same thing with ozone.
100%. 100%. I was even skeptical myself with this. I went to workshops.
Because you're a mainstream guy.
Yeah.
You're a legitimate medical doctor that has been in this.
I went to workshops on this before I was doing it, and I listened to the lectures and I listened to the stories, just like we're talking now, all the same things of how people cured all these amazing illnesses with ozone. I didn't believe it.
Yeah, because look, when I asked that woman 25 years ago, I bet today she would say yes. In certain cases, you could reverse it.
Absolutely.
And the same thing will happen with ozone over time.
I hope so.
But because it's natural, right?
It's totally natural.
You can't really patent it.
And you can't patent it.
But you could put together protocols
that
I guess somebody could sell to people.
Yeah. And, the thing about it is it has no downside. If it's done correctly, the only time people are hurt from an ozone treatment is human error. The gas itself, the treatment itself, does not harm people. The only time there's been an incident, and they're very, very, very rare, it's if someone is not operating the equipment correctly. That's when somebody can get hurt.
Okay. And as a recap, so my blood is going out and coming back in my body.
Correct.
And it's going through two things. It's getting ozone treatment with, like, is it a serum? Is it a
gas?
It's a gas. It's a gas.
You see that oxygen tank?
Okay, so the oxygen tank.
That's connected to the machine, and the machine takes that oxygen. That's 100% pure medical grade oxygen.
Okay.
And the machine is zapping an electric current through that oxygen, and that converts the O2 to O3. O3 is very unstable. It's a free radical. And it goes into your blood, and that free radical oxygen molecule is given off immediately, and that we call it a mild oxidative stress. It's actually a mild oxidative stress, and that triggers your immune system to go into action.
Interesting. And then combined with the light therapy.
Ultraviolet light.
Ultraviolet light.
Yeah.
So I'm going to have some pretty clean blood today. I mean, and during this process, is it a pint? 2 pints? I mean, how much blood is...
Each bottle we're filling is 200 ml. So we're doing 10. That's 2,000 ml of your blood. And your circulating blood volume...
I'm not good with the metric system, so...
Okay, well, I'll tell you, you're
close to a gallon?
You weigh, you lost weight, you're down
I'm
to
160.
160 now,
162,
which is about 75 kilos.
Okay.
So your circulating blood volume is about 0.7 times your weight in kilos. So if we do 0.7 times 7.5, you're roughly 5 liters of blood.
Okay.
Of your 5 liters, we're ozonating 2 of them.
Oh,
40% of your blood is getting ozonated.
Okay.
But in addition to that, when that 40% mixes with all the rest of your blood, it's going to signal like a domino effect in the body. So the cells that are up in the bottle, when they go back in your body, they're going to communicate with all your other cells, and they're going to tell them what to do. And it starts this whole gamut of anti-inflammation in your body.
Okay. I feel good, by the way. I was thinking, is this a placebo? Because I'm feeling good, right?
Yeah.
I mean, you feel really good.
You actually even look better than when you came in. You have much more color in your face.
Well, I slept 6 hours last night, which I'm an 8-hour sleeper. I got up early, and I was excited about this. And but you're really into this.
I love it. I love what it does. I love doing the treatments.
And this is not about making $1 million doing this. This is because you truly believe you're helping people.
Exactly. And I see it every day. I see it every day. I see my patients with successful results, which is dramatically different than what I used to see in the emergency room.
And you know what? You know, there's a term. Give it a try, right?
Yeah.
This is one of those things, especially for people that have infection or autoimmune and they know who they are. It's worth trying because it's not that expensive. And they'll probably feel better, according to you, a couple of treatments a week. They're going to feel better after those 2 treatments.
They will. They will.
So you feel it. It's not something that you don't feel.
I think the only downside really is people have to pay for it out of pocket.
Yeah.
I think that's the only downside. Other than that, medically speaking, I think it's very, very beneficial for everybody. The anti-inflammatory effects are incredible. I think that's one of the biggest exciting things I see when I give people ozone is how anti-inflammatory it is. I mean, if you wanted to reduce inflammation in your body in general, you'd have to take steroids. And you know, I'm sure, how terrible side effects you can get from steroids. They suppress your adrenal function, they suppress your own immune system, they have tons and tons of complications and side effects. You get the same benefit of anti-inflammation from this with none of those side effects. It's incredible.
There's this big talk of
It's almost too good to be true.
There's this big talk in anti-aging or integrative medicine or biohacking about the mitochondria, right? Like little kids that are 8 years old, they run from one place to another. They got all this energy. And as you get older, you start slowing down. What is your take on mitochondria health?
Well, the mitochondria are the little organelles inside your cells that generate energy. That's where the ATP is generated for all cell function. And it's been shown that ozone upregulates that. It actually increases ATP production in the mitochondria and cells at a very subcellular level. That's how ozone can have a beneficial effect on the
Now,
body.
you've had people, you said, that get the treatment and then they go play basketball.
They go straight to the gym
Straight
and
to the
work
gym.
out. I've had guys weightlifting, break weightlifting records. I've had guys go out and bike hundreds of miles on training rides. I've had a boxer, a professional boxer, who would do a treatment and then go work out in the gym because he had so much more energy, and they feel incredible, and they recover faster.
You know, as you get older, it's kind of like losing your hearing. It's so slow that you don't even know how hard of hearing you are.
Yeah.
Right? And like with the energy level goes down so slow, you don't even recognize it sometimes.
It just becomes
your
your
friends
new noise.
notice it.
Yeah.
So is it one of those things that you get the ozone junkies, or they're going, man, I love the way this makes me feel? Do you have any of that yet?
I wouldn't call them ozone junkies, but I do have people who are very concerned about their health, and they're very much into anti-aging medicine. And I would incorporate this into anybody's anti-aging medicine protocol. I think it's a fabulous addition. One of the big benefits that we see from this has been worked out by a researcher in Austria, is that when we get above 8 bottles, which are already past, this is your 10th bottle,
oh boy.
But at 8 bottles, there has been a study that showed that stem cells start coming out of the bone marrow. A lot of people are going...
What's the benefit of that?
Well, a lot of people are going and getting stem cell infusions, right? They go to Mexico, they go to Thailand, they get stem cell infusions. Stem cells are they're precursors to all the cells in our body. So they'll attach to a damaged tissue and they'll become that cell and heal and grow into that tissue and heal it and regenerate it. They're the regenerative cells in our body.
Okay.
So they're not pre-programmed. They're non-committed healing cells in the body. And we have them, and they're elicited at certain times. Like if you get a cut on your skin, what's going to grow new skin are your stem cells. You break a bone. What's going to grow new bone and make that bone grow back together are your stem cells. You have surgery, and you get tissue cut, or you have something implanted in your body. What's going to heal that whole area are your stem cells.
Does this mimic like an injury in a way?
It doesn't mimic an injury, but it mimics the response to the injury.
Because, like, for example, I'm trying to understand this. So, like, let's say infrared sauna, heating your body, or cold therapy. It brings this immune response, right, that helps heal the body in a lot of different ways. And that's what this is doing.
Yeah, this is actually a very, very mild stress to your body. And that mild stress is what revs up your immune system.
Would you put this over infrared sauna as far as benefits?
By far.
Really?
By far. As a matter of fact, I used to do a lot of the IV drips. You know, you knew me in my other clinic, and I've pretty much given them all up because if anybody wants to spend any money on anything, I would recommend putting it towards this.
So you got glutathione treatments or glutathione. I don't know what the difference is. Glutathione treatments, or you have these different IV drips.
The B12.
And you
Myers
would say
cocktail.
You'd rather spend the money if you're going to get an IV. This is the way to go. Do this.
Do this. I have people doing detox work. They're doing cleanses. This is an incredible addition to a detox program, to a cleansing program, because this is going to have an effect on your liver, on your kidneys, which are your primary detoxing organs. It's going to make them more effective. It's going to make them work better. So if you're detoxing already, what you want to do is you want to get your liver and your kidneys to excrete the toxins, and this will actually speed that up for you. So you could add this to a cleanse program or a detox program or an anti-aging program. It's incredible.
Who wants to do this more, men or women, if you had to say the people that are coming in here?
I'd say probably women do it a little more than men. I get a lot of male patients doing this. Women in general are more conscious of their health, I think, than men.
Okay.
They take care of their skin, they take care of their hair, they get their nails done. They're looking at total body maintenance. Women maintain their bodies more than men do. And more women will come and include this into like their overall health. But a lot of women will come and they'll bring their male partner with them.
Okay.
Because they appreciate how beneficial it is and they actually want him to share in it. So a lot of times I see couples doing this together.
Now I see there's an association, one of the certifications on your wall,
Yeah.
American Academy of Ozone Therapy. How does somebody, if somebody wants to learn more, is there a website you recommend where they could look at some of the data, some of the things that are going on in Europe? Or
Yeah, I mean, there's not like one specific website I would recommend, but I think when people are Googling and doing searches, there's so much on the internet now about ozone therapy. There's a lot out there.
you said that our interview, like even what we're doing now, there's not a lot of this going on YouTube or on Instagram. There's not a lot of videos like this out there.
There's not a lot of videos showing the treatment. There's a lot of people talking about it
Okay.
without literally seeing. I think when people see what is involved, it actually makes them more comfortable to get a treatment, because otherwise they can't perceive, how does it work? What do you do? How does that go, you know? But when you actually see it in function, I think it makes you a lot more comfortable to understand how simple it is.
Back to cancer for a minute. The most promising benefits are there as far as, I mean, you think if somebody's been diagnosed with early stage cancer, even late stage?
Well, you know, I can't say it treats 100% of cancer.
Right, but you've had some stories.
I would just have to say that, and the people who I use this treatment on, for the most part, are people who either didn't tolerate traditional therapy, they got sick from chemo, they got sick from radiation, and they want to do something to treat their cancer, or they just don't want those toxic treatments in their body in the first place, and they want to do an alternative type treatment. If you have cancer and we're going to rely on ozone to treat it, you need to do intensive ozone. Many treatments close together for a fairly extended period of time. Okay. The more serious the illness, the more intense the treatment you need to get of ozone. The milder the illness, the easier the ozone is. Like viruses are fairly easy to get rid of.
So how does somebody get started? They're watching this. Do they need to do you need blood work on everybody?
Yeah, I typically get a basic blood panel, and then I have them come to the office and I interview them. I talk to them about their medical conditions, and I make sure there's no contraindications. There's a very few number of contraindications to doing this, but I screen people to make sure that we're not dealing with any of that. And then I do a brief physical exam, and then if everything is good, we go right into a treatment, right on the first visit.
Okay.
You're done.
I'm done. I'm feeling good, by the way. And so I'm cleaned up, so I should probably do this every 3 months. And
you can go run a marathon or something.
I mean, I got to tell you, I feel good. I feel like I've slept.
You play golf?
No, I should.
You
but
hit
I
the
don't.
long ball after this.
But I do work out and lift weights. But it's interesting because I was feeling really tired.
Are you going to work out today?
Going into this. No, I'm a morning workout person.
Oh, me too.
So I missed it.
Me too.
But
you work out almost every day?
3 times a week, at least. I get some activity. But I would say with
Keep
weights.
this on till at least bedtime. There's a compression dressing, and it'll prevent this little poke from bruising, leaking, and all that.
Really? So that late?
Yeah.
Okay.
That went really, really well. Very smooth. No problems. Great treatment.
Okay. Okay, just finished the ozone treatment. 6 hours sleep. I feel fantastic. I'm not exaggerating. I want to thank you, by the way, for doing this. I think if they want to learn more, if they want to get involved, they could just call your office, go to the website. What do you prefer?
Yeah, just go to the website. All the information's there. Contact my office. Give us a call, and we'll get you going.
All right.
Very easy.
Thanks again. Good stuff. So I'll call you tomorrow. What can I expect tomorrow, you think? Think I'll get a great night's sleep?
People generally feel good for, I would say, at least a week or 10 days, 2 weeks. They just feel very energized and feel like getting up and going and working out harder and all that.
Is this one of those things that after an airplane, let's say a flight, you're in that closed space, or you're about to go on vacation, to do it before a vacation, after a vacation?
I have people doing that. I have people doing it so that they don't get sick on the airplane, and they do it when they get off the airplane, and it actually can even help with the jet lag, getting back onto time zones. Yeah.
So young kids, why would parents want their kids to do this?
I don't see a lot of young kids, but
if they're
kids
fighting it like a tick bite or
had a specific
Lyme.
illness or something, we could do it, yeah. I mean, one of my youngest patients was a 9-year-old who had chronic Lyme.
Okay.
And he must have had 20 or 30 10-pass treatments, and he got completely better.
Okay.
Completely better. It was amazing.